If you go to the slide, I think it's the next two, one says treatment, cold turkey versus moderation. And this is really where people say, well, how do you treat internet addiction? I mean, I've tried to explain a little bit about the symptomology and the subtypes of it, but really what's involved with treatment, it certainly varies by culture. I know in China they do more inpatient. It's kind of a military boot camp type of thing. At least that's how it's been characterized to me. You know, in America, it's much more one-on-one counseling and talking to people. So it's not much medication. It's really more talk therapy, which is really something that I've focused on then in my writing and my treatment work. People also talk about, we have addiction models that say you can never touch the computer again in order to treat it. It's not a very practical answer, just because people need to obviously be able to use it to do work. I mean, you work on the internet in most jobs today, so you can't just completely say the internet's bad and then not have a way for that person to function in their work life. So we really talk about controlled use, moderated use. Next slide. Treatment planning usually involves a psychosocial and a usability assessment, symptom and internet time management, dealing with offline time, treating underlying issues, and some kind of relapse prevention, which is what I'm going to talk about now. Next slide. The psychosocial assessment's really evaluating the person. You know, their behavior towards the computer, when they use it, how they're accessing the internet, affective, their emotions. Are they excited to go online? Are they trying to escape from some other problem they're having? What is their real motive? Basically, their emotional motive. And then the cognitions. The third circle is really talking about the maladaptive cognitions that keep them online. They rationalize their behavior. They justify that it's okay to stay online for long periods of time, that it doesn't hurt, that their studies aren't as important as this game. And that's wrong, but that's the kind of assessment you want to make. Next slide. And I just outlined a few questions for a psychosocial assessment in this slide. You want to elicit highly specific examples of behavior. Are they using their Blackberries or their iPhones to constantly access gaming? Are they checking their email constantly? What are they doing? Is it at work or is it at home? Now, we have a lot of home computers. My understanding is other cultures use more internet cafes, where those aren't very popular here. Most people can go out and own 3 or 4 computers in their home. So it's really finding out what it is they're doing online, how often they're doing it, where they're accessing it. Again, maladaptive cognitions might be, well, just a few minutes won't hurt, but those few minutes might turn into hours. I'm not as bad as somebody else. They compare themselves to other users quite often, sort of justifying their behavior. They believe the computer is a machine. They can't get addicted to a machine. They don't believe they're hurting anyone. And they don't really believe it's as bad as drugs or alcohol in terms of the hierarchy of addictions. And emotionally, they could be also dealing with a history of other addictions. It's very common for internet addicts to also say they smoke, they drink, they engage in some drug use. So they have a multitude of problems that they're dealing with. And it's never just the internet. Also, you want to find out usability assessment. I always say it's like any other psychiatric assessment that one might do. You're looking for what are the presenting complaint in terms of the internet. You want to do a family history. Oftentimes I see young men from either broken homes where mom and dad are divorced and the boy is living with his mother and has a weak father figure. That is something that I've seen often a lot with men who are addicted to online games, or very over-controlling parents. We here use a phrase called helicopter parents, where they're always around their child, doing all their work for them. And that is usually a sign of somebody that's going to be addicted to the internet, because they're looking for a sense of their own control. And they could go in a game and become a great warrior or leader within these game environments. Meanwhile, their parents still treat them like they're a child, and they don't have any sense of control or leadership skills, but yet they can develop those in the game environment. Education, usually quite intelligent people get addicted to the internet. Medical history, if there is any kind of other problems going on, other medications. If they're very depressed, they could be using the internet to escape feelings of depression. We use something for like a structured clinical interview that's sometimes called the SKID. The Internet Addiction Test is my test that I've made up. It's a 20-item validated instrument that, again, has been widely used in the field to try and determine internet addiction and the severity of it. The Internet Addiction Diagnostic Questionnaire just kind of says, yes, you're addicted if you meet those criteria, those first slide I showed you. But the IAT, the Internet Addiction Test, is more extensive and tells you if it's like mild problem with internet or serious problem with internet. So the severity is somewhat measured, and a lot of people are looking for those numbers. You can review server logs, the actual log-in process of the computer. Some people do that. And what I ask people usually to do to give me a sense of their, what I call their baseline, where they're beginning their treatment at, is to keep an internet time log. And next slide really is just the time log itself, outlining just a little bit about when you go online, at what time of day, what's the duration of your online use, and what's the outcome. So in this case, this was a man that I worked with. He was I believe a 45-year-old attorney, and he'd go to work and he'd check his email in the morning, as you can read, and that was fine. At lunch, maybe he'd check his email again, and he'd sit there for a while at work looking at his stocks. But it was after work, when he completed a particular task or a memo he had to do or report, he'd call his wife, say he'd work late, close his door, and use his work computer to look at online porn and to engage in sex chat rooms to hide this behavior from his wife. So the outcome of that is he felt guilty. He felt that he lied to his wife. He didn't get any work done. This was unproductive use of his time, but yet he could spend 2 hours every day after work doing this. And he'd come home, eat dinner, and then again he found late at night he was going online after his wife went to bed and his kids were asleep, looking at porn. So, on a daily habit, he could be spending 5 hours a day or so just looking at pornography on the internet. That became a very significant problem in terms of his productivity and his relationship, certainly with his wife. Next slide. The next thing you want to do, once you address what the current baseline is reconstruct when you use the computer. If we're talking about moderated use, certainly you need to limit and have a very sense of control. For me, this means limit any non-essential use. Anything from, like, you don't have to read the news online, or you could go buy the newspaper. You don't have to buy that book on Amazon. You can go and buy that book in a bookstore. But you're trying to limit any entry and work on the internet to only what you really absolutely need to do your job. Any trigger applications, obviously you can't, if pornography is the problem, you have to abstain from pornography. If gambling's a problem, if gaming's a problem, applications you can abstain completely from. But the internet as a whole still has some other opportunities for positive use, healthy use. And reducing anonymity. One of the things I found is that the more people are very accountable for their internet use, using their real name, making their computer visible or public, that does help. Next slide. What are you going to do with your offline time? Now maybe there you work, you focus on your academics. I always get the sense that, especially with young people, that's the biggest thing that goes first, is their quality of study. But it could be for the older adult, something like volunteering in their community, recreation with their friends, getting exercise, getting the right amount of sleep since they're probably sleep deprived, trying to look at support groups or spiritual wellness or other ideas. But the thing is, if you're taking all that time away from the computer now, if you're spending 60 hours a week on the computer and now you're only spending 20, then those other 40 hours need to be accounted for. You need to keep a very structured schedule, okay? You want to treat underlying issues. Again, the computer and the internet are not the problems. A lot of times the problems come from the patient. The patient is having anxiety, problems at home. They're dealing with depression, loneliness, feeling like they can't handle school. They don't fit in school, socially awkward. Any other reason that the person is dealing with that problem through the internet is really what we call an underlying problem. The internet becomes the symptom, and the person is really sitting there saying, I have to, game in order to feel good about myself because I don't feel good about myself in my real life, or my parents control me so much, this is my time to control my character, my avatar. So a big part of that is dealing with how you're going to approach those things. Next slide. The biggest thing is once you can achieve, I think, a very normal pattern of use with the internet, a very regulated and controlled use, then you don't want relapse to occur. But relapse is what I call a mouse click away. We are at computers all the time. So, this is very typical 12-step recovery, if people are familiar with that. 12 steps, very, the AA model, I should say. And really it focuses quite a bit on spirituality, but also just looking at signs of relapse. If all of a sudden somebody's spending more time alone, that could be a problem because they might be alone at the computer. They overestimate their recovery. They say, well, I quit the internet for like a week and I'm fine. And then they go online thinking they can handle it. They lie to themselves and to others sometimes about slips. They say, well, I slipped and went online for a little bit, but that's okay. They have to be very honest about their behavior. A lot of times you make guidelines or contracts with patients to not go online, and they break their contracts or those guidelines. They blame others, their need to use, if my wife got along with me better, I wouldn't have to go online, or if my parents understood me better, I wouldn't have to go online. Again, it shifts the blame from somebody else, and that shouldn't be. The patient is the one responsible for their behavior. And finally, minimizing any return to problematic situations. Really, it's become a bigger problem today in our society. And internet addiction, it's still only being recognized in the United States. In the DSM-5, our next revision, it's going to only be in the appendix, meaning that further study is going to be needed and required. So that's a good thing that it's being classified, but it hasn't made its status all the way up to its own classification. So we need to really consider that. In the US, there's really not much treatment available. It's really, because it's not absolutely recognized, we get other addiction centers here that will take in internet addicts, but it's not something they've focused on exclusively as a problem. The way I've seen, my understanding at least in Korea, is that you have very many treatment centers dedicated to this, and that's just not something we have available to us at all. So what I've tried to do, that's pretty much the end of my talk, and I'd like to open it up to any comments or questions. I've tried to just give you a little overview of some of the key areas, and certainly if you'd like me to talk a little bit more about anything, I'd be happy to do so.